What's wrong with you?
Oh, I have tuberculosis.
Mycobacterium tuberculosis, also known as tuberculosis, also known as TB, also known as fistula, is the plague and consumption. It has a lot of different names if you can't tell. It is believed to have originated in East Africa around 3 million years ago. Scientists also believe that seals are responsible for bringing tuberculosis to the Americas, which honestly leaves me with a lot more questions than answers. So watch out for them. They're more evil than they look. The earliest known case of tuberculosis in humans was around 9,000 years ago in the ancient city of Adet Yam. It was detected in the remains of a mother and her baby boy, which is pretty depressing. Ancient Egyptian mummies also have traces of tuberculosis on them, and the first written record of tuberculosis was in India around 3,300 years ago. The doctor who wrote that record has been lost to time. How sad. As tuberculosis became more and more prevalent throughout populations, monarchs decided to use a treatment known as the royal touch. It was started in the year 496 by King Clovis of what would become France, and was also a way for monarchs to prove their divine power and right to rule. As you would guess, this method didn't work. For some reason, it kept on being used as late as 1702 until people started to realize that the whole royal touch treatment was a bunch of, BS. 25% of all people who died from 1600 to 1800 were from tuberculosis, and it was known as the robber of youth because the mortality rates were noticeably higher in children and young adults. Tuberculosis was also romanticized during the Victorian era. The pale and emaciated look it gave to people was considered attractive for some reason. Many authors and poets romanticized tuberculosis, including the famous Edgar Allan Poe, who had this to say about his wife infected with the disease. I can't make this up. Her sickness is a strange additional charm, which rendered more ethereal her chalky pallor and her haunted liquid eyes. I expected nothing less from a man who married his 13-year-old cousin. Tuberculosis was considered so attractive, in fact, that many women will reportedly poison themselves to replicate the look people infected with the disease had. I thought beauty standards today were pretty awful. In the 19th century England, people thought tuberculosis was caused by vampires, which is kind of funny. People also believed that their relatives who were deceased with tuberculosis would drain the life out of living relatives and infect them with it as well. This caused people to visit their deceased relatives, dig up their corpses, and freaking burn their dead bodies to stop the curse. Hope seemed lost until March 24th, 1882, when German scientist Robert Koch confirmed that tuberculosis was indeed a bacterial infection and not hereditary. This discovery led to two bacteriologists, Albert Gamate and Camille Guen, to begin researching for a cure in 1900. Their research was going great until 1914, with the assassination of the notorious Archduke Franz Ferdinand and the start of the Great War, also known as World War I, as we call it today. They were able to continue their research, though, shortly after and finalized the Bacillus Calmette-Guerin vaccine. I have no idea if I said that right. Or BCG vaccine for short, in 1919. They began trials and it was released to the general public in 1921. These two were considered heroes until 1930, when children given the BCG vaccine in Lübeck, Germany, were all contracting tuberculosis, and 29% of them died. The German government did an investigation to determine whether the vaccine itself was at fault, and after 20 months, they concluded that it's not the vaccine's fault. The scientists were just really bad at sanitizing the lab and doing their job. Actually, 2 scientists were ended up behind bars because of the whole fiasco. Although the vaccine helped, tuberculosis was very deadly until the invention of streptomycin and perimycinic acid, or PAS for short. Now let's take a look at some of the awful treatments doctors and scientists used to use until the vaccine and effective antibiotics were used. Some of the more normal treatments included sunlight therapy and herbal concoctions, or plant medicine. Some of the more outrageous treatments included induced bleeding, or slitting the wrist of victims to get the infection out of the bloodstream, electric shock therapy, isolation, and, I kid you not, milk transfusions. Yeah, scientists would inject goat's milk into the system of patients to try to fight the infection. It worked about as well as you think it did. Although tuberculosis is no longer an issue here in the United States or most first world countries, about 1 million people a year still die, mostly in areas where access to proper care is very limited. So, what does it actually do? Basically, it sucks a lot. It mainly attacks the lungs, but some strains of tuberculosis can also attack the brain, spine, and kidneys. Symptoms include coughing blood, excruciating chest pain, weakness, fatigue, fever, pale skin, and rapid weight loss. The prognosis of tuberculosis nowadays is usually a healthy recovery in areas where you have access to treatment. Any time before 1944, though, yeah. People most susceptible to tuberculosis include children, people with HIV or AIDS, people with diabetes, underweight people, people with drug addictions, and those on immunosuppressants. The two main ways to test for tuberculosis include a TB skin test and a TB blood test. In a TB skin test, a trained professional will inject your arm with a fluid called tuberculin. You return in about 72 hours to see if your skin had any reaction to the fluid, and if it has, you're TB positive. In a blood test, they just check your blood for traces of the infection. It's a lot less interesting. The best way to treat tuberculosis nowadays is just with antibiotics or the BCG vaccine if you live in an area where tuberculosis is common. And yeah, that's all. Bye!